A groundbreaking study has brought hope to patients suffering from advanced dry macular degeneration, a condition that robs them of their sight. But here's the twist: stem cell therapy might just be the key to restoring vision. The Tribune reports on this revolutionary trial, sparking excitement and controversy in the medical world. In a first-of-its-kind experiment, researchers are testing adult stem cell transplants to treat this debilitating eye disease. The initial findings are astonishing. The treatment is not only safe but also shows significant promise in improving vision, even for those with severe vision loss. This is a game-changer for the millions affected by age-related macular degeneration, AMD, a leading cause of permanent vision impairment in adults over 60. The study, published in Cell Stem Cell, focused on retinal pigment epithelial stem cells in a phase 1/2a trial. These cells, sourced from adult eye tissue, are crucial for sharp, color vision. AMD patients typically lose these cells, leading to central vision loss while peripheral vision remains unaffected. The trial's participants received specialized stem cell transplants, and the results were remarkable. Even at the lowest dose, patients experienced measurable vision improvements in the treated eye, with no adverse effects. This is a crucial finding, as current therapies only slow the disease's progression, unable to restore lost vision. But here's where it gets controversial. The study suggests that stem cell therapy might be the missing piece in AMD treatment. Dr. Rajesh C. Rao expressed surprise at the magnitude of vision improvement, especially in severely affected patients. This raises the question, could stem cells be the ultimate solution for AMD? As the trial progresses to higher doses, the research team remains cautiously optimistic. They are closely monitoring participants' safety and vision changes, hoping to confirm the therapy's effectiveness. This NIH-funded study at the University of Michigan could pave the way for advanced regenerative medicine treatments, offering new hope to AMD patients. The study's implications are profound, but it also invites debate. Will stem cell therapy become a standard treatment for AMD? Are there ethical considerations or potential risks we should be aware of? Share your thoughts in the comments, and let's explore the possibilities together.